I heard a stat recently to put this in perspective. You know, I get lost sometimes with all the hundreds of billions and trillions. It's hard, they're so big, it's hard to really put them in context. Here's a simple statistic for you. In the budget that President Obama has imposed, for every $3 spending, we pay for over $1 of debt. Think about that. Think about it as your own family, financing 1/3 of what you're spending with debt. That doesn't even count the interest or principal payments on the old debt. This is all new debt. We're spending 50% more than what we take in. That's extraordinary. We can't sustain that. Yesterday, reports came out on Social Security and Medicare. And the stories have actually been a little bit misreported because you know we have a trust fund for those entities, but we've already spent the money. And we just borrowed it. And so really the trust fund is illusory. Well, in 2016, Social Security is going to start taking in less than it has to pay out. So in theory, it's drawing down the trust fund. But it's another trust fund for all day. Medicare right now is already paying out more than it's paying in. So there's some serious problems. And we have a runaway government that's controlled by liberal Democrats. We have a lot of conservative Democrats in the state that are bothered by this. It's not just a Democrat-Republican thing, it's a liberal conservative thing. So we need to check in Washington, D.C. Jerry was telling me this morning, the president had a press conference, he was talking about health care and energy. These are two huge topics. Health care, there's something you're going to hear as they go through this debate over the next couple of months. It's called the public option. And it actually doesn't sound that bad when you think about it superficially. The idea is let's have a government insurance plan for those who don't have insurance. The government will pay for it. And we know that's bad, the government gets involved, but it doesn't sound really bad. Here's why it's really bad. When the government pays for health care, it sets the rate. So it pays whatever it wants. In Medicare and Medicaid, the rate is lower than the market rate, which pushes our private payments higher. It's actually a much bigger cost shift from Medicare and Medicaid to private plans than there is from uninsured to the insured, because they just raise the rates for everybody else. Well, with a public option, another government-funded health plan, they're just going to pay the same rates, and they'll be able to drive out private insurance. If we drive private insurance out of business, what do you have? You have a single-payer system. So this is the first step to government-run, 100% government-run health care, which means there'll be a bureaucrat in charge of making the decisions. That is a health care crisis. So we have to stop them now. And I hope Senator McConnell and Senator Bunyan and our congressional delegation can do that, because they really want to do it this year. A better approach is to look at some of the practices we've already put in place on wellness programs, trying to reduce costs through that, through information technology, and focusing on treating whole diseases rather than specific treatments. There's a lot more we can do to make healthcare work better. Energy. This is one of the biggest issues we've got. It's a national security issue. It's also an economic security issue. There actually was a study I read a couple of weeks ago that one economist, it's only one economist, economists have been really good at predicting things, but I thought it was interesting. One economist reported to show that the recession was actually blamed entirely on the oil price shock from last summer and the reverberations in that. Whether it's true or not, we all know that was a big deal. It really shook us last summer, both directly in our pocketbooks, but also psychologically when those gas prices doubled. And now every day we watch them actually they've been up a lot in the last week. So energy is a big deal. For our state, it's a really big deal. There's only about one competitive advantage our state has when it comes to getting manufacturing jobs. And that's our utility rates. They're low. They're one of the lowest in the country. And that's because about 98% of our utility rates come from coal. Well, the administration wants to attack coal with this cap and trade tax. We'll call it cap and trade and the word tax because that's what it is. So that'll hurt us. It'll hurt the coal mine jobs and the ancillary businesses. It'll hurt us directly because our utility rates will go up. Instead, if we invest in clean coal technology, we invest in biofuels, we have a lot of agricultural land, we could be an energy leader and maintain our price advantage. So this is a really tricky issue for us. This could be either a double whammy or a double win.